Joe, I take it we're ready?
Yep, we're live.
Thank you. Good afternoon, good evening.
Mick's disappeared again.
Does look like
I've
Mick's
lost the sound.
does look like Mick's disappeared, doesn't it? Well, I will take over chairing the meeting. Hello, everyone. My name's Joe. I'm political officer for Labour Unions. Thank you for being here tonight. We're talking about protecting key workers during COVID-19. It's International Workers' Memorial Day tomorrow, so it's a brilliant time to be having this conversation. Mick, you're back.
Thank you, Joe. Good afternoon. I apologise for the technical difficulty there. My name is Mick Whelan. I also happen to be chair of TULO. TULO is the organisation that deals with the 4 million trade unionists who are part of the Labour Party and those 12 trade unions. And I think, as Joe was saying, this is a particularly good time to be having this discussion. This is the evening before International Workers' Memorial Day, which we celebrate tomorrow at 11 o'clock. Now, within this pandemic, workers everywhere have been far more at the fore, particularly those that haven't been recognised in the same way as the past. We've had a long tradition of recognising the bankers and those who put heavy investment in. And strangely enough, it seems like the Ashleys and the Bransons of this world and the Stelioses are now coming into disrepute for the strain that they're putting on the economy, particularly those who don't pay their taxes, who don't give anything back, and those that have been undervalued for years, who haven't been properly remunerated, those that are the bedrock and at the heart of our communities, that are essential to everything that we do every day, those key workers that Paddy represents, those in the NHS and those in social care. I hope the respect that they're now receiving continues when this pandemic is over. As we move on through the evening, you'll be able to ask questions after our speakers have contributed. Each speaker will speak for 3 to 5 minutes. Not all the speakers are online yet, so the lineup might vary slightly. And after that, you can all ask a question by clicking the Ask a Question button at the bottom of your screen. Please, if you would, can you make these questions and not long statements or comments so we get more opportunity for more people to come in? The way in which we have to work has changed. And also, I think there is going to be an awful lot of worries in the next few weeks about what the government might do politically rather than for the safety of workers and for communities. Is it the right time to go back to work? I've already seen criticisms in the right-wing press about the trade unions demanding safe methods of work before we have a fully fledged return to working and going back to the workplace. We need to be convinced that everybody is safe. We need to be convinced that we're not going to store up a second opportunity for this pandemic to hurt us and drive us in a different way forward. In my own industry, we've seen demands in certain areas to ramp up services 75% from the 4th of May and onwards. And we will have conversations with the employers. And if we're not convinced that the people that we take to and from work and the people that work within the industry are going to be safe, I don't think we'll be lifting the services at those times. But that's a debate for another day. The trade union movement, strangely enough, hasn't been at the heart of government's thoughts for the last 9 years. In this austerity-driven world, we've had a long battle to fight for people's rights, to fight for our voice, which has been severely damaged by the trade union bill and other legislation that's come in the last few years, particularly the lobbying and transparency bill. And it is interesting that once we see the value of workers, once we see the value that we are a society again, and to hear someone like Boris Johnson say that, it's really intriguing. Right? The value of what we do, and all of a sudden, we all want to work with the trade unions. We all want to work with the movement. We all want to work with those who represent workers to protect the all of society at this time. So I thank you for coming on today. I thank you for listening. And I look forward now to introducing each of the speakers in turn. I believe the first speaker to this evening is going to be Christina McAnea. She's the AGS. And Christine will introduce herself, talk about the issues in her area. And after she's spoken, I'll introduce the other speakers one by one, and then we'll go to questions. Christine.
Thank you. So I'm Christina McAnea. I'm the Assistant General Secretary for Unison. My areas of responsibility are for our bargaining, negotiations and Equalities Directorate and services. So my teams have been running all the sort of issues around how we negotiate and campaign around all the COVID-19 things that have come up from our members. So some of you will know Unison is the big public sector union. We've got 1.3 million members. Most of our members are still working at this time, so most of them are working in either health, local government, social care, to an extent education, fewer there, but still some of them still working there. And we have some other areas in the private and voluntary sector where many of our members are working. So the big issues for us have been around how do we ensure that the members are able to continue to do their job, essential jobs that many of them have, but in a way that's safe, not just for them, but for the client groups and the patients that they look after. So we've been very closely involved in discussions with employers and some of these national organisations like local government and health or police service to try and get good agreements in place almost right from day one on how do we take these things forward. It's been more difficult in the areas where we don't have a national framework, so things like social care, where we've got loads of members who work in the social care sector. It's been very difficult there because there is no national structure, as people will know. And the big issue for us has been, without a doubt, the number one issue in our union has been around PPE, personal protective equipment. How do we get the right level of personal protective equipment? How do people know what the right level of PPE is for the jobs that they're doing? Has there been appropriate risk assessments? And this is something that's continuing on a day-by-day basis. So even though there has been guidance that's come out from Public Health England, although there's been guidance that has come out from the Health and Safety Executive and from other health organisations in the other parts of the UK, the problem has been getting that message across both to the members and to the employers, and also the continual flow and delivery of PPE in some of these key sectors. So you'll have seen in the news the big issues around accessing PPE in health and social care. That continues to be a major factor and probably makes up the bulk of the calls and emails that we receive in the union. We've set up a number of internal things to try and make it easy. So we've set up a social care hotline, and for our members who work in social care to email us directly, and it's a sort of interactive one. So we've been trying to, as people come in with problems saying, you know, I work in such and such a care home, there's a massive problem there, how can we deal with it? We've got systems in place where we go back and try and resolve that. We've also set up another thing which is called our PPE alert, where it's more anonymous. People can just email in their particular issues, and we're using that to gather information and evidence to put forward to both to government agencies and to the government on what the key problems still are. So there's been a big issue around some of these things. I think for me, the two big things going forward are there's short-term and long-term issues. So there's the long-term issues about when we get through this, but what we do about the value, some of the stuff Mick was talking about, what we do about demonstrating the value of public sector workers. I mean, it's not just public sector, because you've got all the other sectors that have been involved in this, but for my union, it's predominantly how we enhance the value and demonstrate the value of public sector workers. Do we have a different, is the time right to have a different conversation with the government around the value of public sector workers, and particularly those that have been ignored for many years? So again, I go back to social care on this, where it's predominantly female, predominantly low paid, many of them on insecure jobs, and we're written off as low pay equaling low skill and therefore low value. And of course, this pandemic has proven that that's a complete myth, and actually that it's many of the people who are the lowest paid in this society who are helping to get us through it. So in one sense, that's the longer term discussions. How do we keep that going? How do we engage in trying to get a new deal for them, in a sense, at the end of this? But there's the short term issues, which are just basically how do we get through this? How do we get our members safely through this? And how do we keep pressure up on the government and agencies? So we've had fairly good engagement, I'd say, in terms of, so we already have a good tripartite social partnership arrangement in some sectors, like the health sector. It's patchy in some others, and in some others non-existent. We've had quite good engagement from organisations like Public Health England. By that I mean they're talking to us, doesn't necessarily mean they're listening to us or taking on board the things that we want them to do, but that element of being involved in the discussions is certainly there. And then there's issues around what are our short-term risks for our public sector workers, and that's a debate we're still having, a discussion we're having within the union, and it's one that I think we'll be having across the TUC as well. Is that sort of enough to start us off? Will I stop there and Mick can let someone else come in?
Thank you, Christine. That's wonderful. And thank you, Christine, once more. That's wonderful. And that gives a good overview of what's happening in Unison and in your sector. I'd like now to pass to Paddy Lillis, the GS of USDAW, if you'd like to come in and speak about some of the challenges that you're experiencing. Paddy?
Mick, are you asking me in now?
Yes, Paddy, I was just introducing you. I was just asking you if you could come forward and talk about some of the challenges you're experiencing and your members.
Mick, I can't hear a word you have said, so I presume you're asking me to come in. Just know that's the case. Right, fine, thanks, Mick. Look, all right, cheers, Mick, thanks for that. Look, I'm Paddy Lillis, the General Secretary of USDAW, and for those that don't know, we represent many of the workers who are keeping the food supply chain moving during this crisis, from the factories to distribution centres to supermarket shelves to the home. And I'm extremely proud of our members, and I'm also proud of the way that USDAW reps and officials have stepped up to support them. And put on record, I think the whole trade union movement, its reps and members who are working, have stepped up in what is a national emergency. In terms of food retail, we've been in constant dialogue with the employers throughout the outbreak to ensure we keep our members safe and also the public. Much of what you see in the supermarkets is a result of those discussions, and a few examples of that is perspex screens installed at store checkouts. Many of you will have seen them as you go into stores. Limiting the number of customers allowed into stores at any one time, and of course at the start of this health emergency we've seen a panic ban, and I'll come on to that in a moment. And then there's a regular cleaning and sanitising of the store and wipes to clean devices, till points, self-service checkouts, etc. And then of course encouraging card payments instead of cash, and again to stop the transfer of the virus. And then reminding customers in the stores and outside the stores to keep a safe distance, and also ensuring that doorstep only grocery deliveries are made, so when .com drivers are just leaving the groceries at the front door and not going any further. Now, one of the concerns we have had during this health emergency, we've just carried out a survey of our members between the 3rd and the 12th of April, and over 7,500 of our members has responded to the survey. But frighteningly and probably annoying, that out of the 7,500 people, that's 7,500 members who responded to the survey. 5,000 of them were retail workers at the front line, serving the public in the communities every day, ensuring the food and water, etc., is given to the general public. And out of them 5,000 workers who were surveyed, 62% of them experienced verbal abuse. 62% verbal abuse in a national emergency where people's going to work, putting their own health on the line, their family's health on the line, and they've been abused by a small minority of the public. On top of that, a third of them were threatened, physically threatened, and sadly over 200 were physically attacked. And that's only from 5,000 workers. If you scale that up to every retail worker in the country, that works out every 3,500 workers in a working day. Now, in anybody's mind, it's shocking, it's deplorable. People stepping up to the plate, making sure that the country's fed and watered, and there we have them being abused for just trying to do their job and help the communities. And I've said all along, the retail sector is the beating heart of the communities. They're there in support. They've been ignored and have been invisible for many, many years. And now people have seen them for what they are. Individuals who are there at the sharp end, along with others, trying to ensure the country gets through this national emergency. So again, we are asking that the general public respect, value and appreciate retail workers, and that the government needs to do more to protect frontline workers when they are physically attacked and abused, that the sentences fits the crime. So I'll stop at that for now, Mike, and more to say later on.
Wonderful, thank you, Paddy. It looks like Mick's having a few technical issues, so I'll step in there. Carl, I'm going to invite you to come in now. Carl, you're a national exec member of Communication Workers Union, is that right?
Yes, Joe, and we represent around 200,000 members in postal, telecoms and financial services. And some of the issues that we've encountered from the beginning of the epidemic was even down to getting the basic PPE. Clearly, in post, we get mail coming in from all over the world. And in the beginning, the government guidance wasn't clear. And obviously, our members were conscious of the fact that there was a lack of guidance around, and that when you combine that with not having the simple PPE of masks and gloves, that was an issue for us in the beginning, particularly within Raw Mail. They were slow off the mark. We now thankfully have all PPE, sanitizer, gloves and masks. Social distancing can be a problem in some of our offices. We've got some offices that are small, and clearly with the mail coming through, and particularly in the smaller delivery offices, keeping the social distancing, that was an issue in the beginning. Thankfully, we have now managed to sort that out. There's still some issues, and on a daily basis, because of the amount of particularly parcels that are coming through, because Raw Mail are still running their full service. They haven't run an emergency service, and our members are out there delivering that to every household in the UK. On top of that, we are delivering medicines. We're also delivering and collecting testing kits from going around the country. One of the biggest issues that we've also had is pay, sick pay, where people have been forced to self-isolate, and if they've been seriously ill in the past, they weren't going to be paid. And hopefully we're expecting some news on that, because within Raw Mail they were adopting their normal sick pay procedure. We've other issues that we've had is we have people that share vans. So clearly, only one person in a vehicle. We've created the situation around that. Then you've got the issues that come with that of cleaning the vehicle after it's been used to make sure there's no contamination. So there's a lot of issues that we've had to deal with the company. It's been the union pushing them on that to make sure that these issues have been resolved and the safety of our members has been put first. We've also come up, as most customers will know, we've now created the contactless parcel delivery, where before we'd have to hand over for the members, for the customer to sign. That has also a risk of contamination within our even within our our telecoms, for our telecoms members as well. They're out there keeping the country connected and coming into contact with the public on a regular basis. I think in the beginning the message wasn't getting through, but thankfully, the public have got the message that we do need to keep the distance. We can make all the transactions that we need. We've also got members that work in post office counters, and similar to what Paddy was saying, some of them are getting abused within there, although they are providing a vital public service. But without the union pushing the companies that we represent, I think our members would have been in a lot worse situation. We are still pushing and pressing to make sure that what's in place stays in place, and that each company does do what it's meant to do going forward and making the workplace even safer, because we are key workers, that we're out there in amongst the public every single day, and we will keep pressing forward to ensure that our members are as safe as they can be. Thank you.
Wonderful, thank you, Carl. It looks like Diane is ready to join us.
I think so. Am I here?
You are. Well, it sounds like you're here. It looks like you're here.
That was a stressful moment. Thank you, everybody, and thanks very much to Chulo for organising this. I think it is so important in these current times that we get together, because so much is dividing us. I wanted to talk first of all about, because my responsibilities include the transport and food sectors, and one of the things that I think has been so important has been recognition that transport and food sectors are really important key workers, and that they have a vital role to play. So often people in these sectors feel undervalued and unrecognised. However, some of the rhetoric and some of the things that are being promised have not been the same in the workplace. And we've had, right at the beginning, I think, when a number of undertakings and commitments were being made, to find that our members were saying, but it's just not like that. And the reality is that some of the employers were not listening and were trying to make people work in a way that they felt was absolutely unsafe from all the public health advice that they were hearing and being given. So as a result of that, there were some workplaces where people just said, no, we are not working like this. And that changed things. In other workplaces, we had good discussions, negotiations and agreements right from the outset. So where people are working, we've got now a number of changes about how they're working, whether it's staggering of shifts, changing of start and finish times so that there's not so many people coming, travelling together or coming into the workplace at the same time. We've got reorganisation of how things are being done so that people are more protected and able to distance from each other. I heard of one food factory where, because some people had very vulnerable members of their family at home that they were extremely concerned about, they made arrangements for different high-vis vests for people who were particularly nervous about making sure they were properly protected. We've also, I think, with International Workers' Memorial Day tomorrow, got to remember and pay tribute to everybody who is both ill and also who has very, very tragically lost their lives as a result of COVID-19. Bus drivers, I think, were being taken for granted in the role that they play in transporting people, although key workers themselves transporting key workers too. And I think with a number of deaths in that sector, it really brought to the forefront that they were at risk as well. Like other drivers, they don't get access to wash their hands on a regular basis. So although people were saying that coins and that money was not as much of a threat or a risk to them as they were saying, they were talking as if they had the chance to wash their hands regularly, which they absolutely do not. And in fact, access to toilet facilities and any welfare facilities for lorry drivers as well as for bus drivers is a massive issue. So there's a big risk assessment going on in the bus industry, and there's been huge changes made in road haulage. What we want to see is that as new companies come back to work, that we make sure that everybody learns the lessons before people return, that there is a proper deep clean, that we check that places are safe for people to work in, and that the new way in which people are working now is accepted and people are understanding it and operating it right from the start. We don't want to have to go through those difficult times at the outset when it wasn't being taken seriously. I think we've also, alongside health and safety considerations and changes within the workplace, we've been trying to look at all those things that people need to keep them safe and to enable them not to come into work if they're unwell or if they're at risk. And that's why the aspects of the job retention scheme have been so important, and those protections that are there. So as part of managing all of this, we need to have the right income protection and job protection around it. Otherwise, people will be feeling forced to work in unsafe conditions. And that's something that we absolutely have to prevent at all costs. So there are many hazards out there. And I think in dealing with a new issue, we can't forget all the ways in which we deal with hazards and how we look at our health and safety protections. And similarly, the protections for anybody who's particularly vulnerable, whether through disability, through pregnancy, just to make sure that where additional protections or the right not to be in the workplace but without loss of pay, that those are all properly protected as well. So thanks to everybody for joining, and thanks to you Unions Together for organising this, and also to just say that Unite is working really hard to make sure that our members are safe, and that we remember all of those who've suffered through industrial injury, accident or illness, and that we think of them as we continue to fight and struggle for the living. Thank you.
Wonderful. Thank you, Di. Really glad that you could join us. I think some of our speakers are having technical issues. So what we'll do is I'll ask a few questions, and hopefully we can have speakers chip in as and when. Hopefully they can hear what I'm saying and they can contribute, and we'll take it from there. So obviously there's quite a lot of questions around the standards of PPE within different sectors, within different workplaces, and there's also a different question about the availability of PPE. There's a particular question around Royal Mail staff, so I'll just bring you in there, Carl, if that's all right. Can you speak to the standards of the PPE and the availability with regards to Royal Mail staff at the moment?
Yeah, the PPE, as I said earlier, the Royal Mail were really slow off the ground, and clearly by the point that they got their act together, lots of other companies were vying for the same PPE. Clearly handling parcels and packets all day, coming from all over the world, and interactions with members of the public was a concern. We have a level of PPE. We are having some issues with some masks that our engineers need, getting the correct quality of that. And there's been issues in some of our areas around the country with replenishment and things like that. But once they did, once we started to get the PPE, it was limited, and the same as most some of the other companies have done, that they'll keep shouting about how much they've spent on PPE, but at the end of the day, there is no cost to keeping people safe.
Wonderful, thank you, Carl. Di, can you just speak to that as well in terms of the standards of PPE which you've seen in workplaces and sectors, as well as the availability? Has there been a struggle in terms of making sure that PPE is of a standard which workers are happy about?
Is that to me?
Yes.
Oh,
yes. Did you get that, Di?
Yeah. I think the approach has got to be what it always is, which is to try and eliminate the hazard. And so what we've been trying above all is to prevent people being put in a position where they are at most risk. And one of the things that we think has caused quite a lot of difficulties and problems and anger and concern is where the standards appear to be changing and what is safe is changing and whether or not certain protections are needed and so on. So I think first and foremost, we're trying to have people be able to work away from each other sufficiently that it's seen as less of a risk, and also that there is, for example, if people are sharing a cab, that there is of a lorry or something, that there's proper deep cleaning between it. But where people do have to work together, or where PPE is supposed to be provided, which at the moment in the sectors that I'm responsible for is in very limited areas, other than the PPE that was there beforehand, that they were required to have beforehand, then I think that we are really just in the early stages of it. What we found is some companies that are multinational, there are global requirements for certain standards which aren't the same requirements as Public Health England or the requirements in Scotland and Wales are in terms of PPE. So I think our message to the government has been, make sure that the requirements are absolutely clear, because it's causing a huge amount of distress and concern where people feel they ought to have PPE and it isn't being supplied.
Thank you, Di. And what, in your experience, and what has your advice been to workers where they've been put in a situation where they don't feel that PPE is adequate? You know, it's a terrible situation for any worker to be in. You know, especially in insecure workplaces where you know, there might be bullying or overbearing management, or people are on insecure contracts and whatnot. What is there a one-size-fits-all advice around if your members are in a situation where they feel that PPE is inadequate, or is it much more nuanced compared, you know, in regards to the situation that they find themselves in?
If somebody is being required to work somewhere which is not safe, then they do have certain legal rights to put themselves into a safe position. And we're telling them those legal rights, obviously. But above all, our aim is to prevent the hazard. We don't want anybody to be put into that kind of a position. So the advice is, you're not on your own. You can get support from a union. If you're in a workplace where the union isn't recognised and there isn't sufficient discussion, negotiation with the employer to sort out and prevent problems like this, then there are legal rights that individual employees have. Not the same rights if you're a worker, I'm afraid, but there are rights there to remove yourself from an unsafe position. And that's something which, obviously, if it's very, very clear that there's an unsafe position there, then people can stop doing that work or move away from it, and they should not suffer as a result.
Thank you. Another question and another demand from particularly frontline workers in the healthcare sector, I know you've got healthcare members as well, has been around testing. Obviously, there's been, let's say, a lack of capacity, or capacity has been outstripped by demand, especially in the last 3 days when the government has made it an option for key workers to request tests at home. They've been snapped up in hours, a number of hours or minutes even. Is that something that you're hearing a lot from your members, that they would like more testing to know definitively if they do have the virus, that they should therefore, of course, stay home? It's a very it would give them that kind of reassurance to turn around to their managers, to their bosses, and say, look, I've had the test, I will be isolating for the next 14 days. Has testing been a big issue?
I think the change that's happened very recently is that transport and food workers are among other workers who are not health workers, but who are now entitled to testing. So this has very recently become a big issue in the sense that they can apply. I have been hearing that people are really welcomed that opportunity because it could mean they could act a lot better to protect their own safety. But I think above all, the concerns I'm hearing is people are very worried that they're putting their families in danger and people that they're looking after at home in danger. And that is something which they would want testing for, so that they know that people that they're working alongside, as well as their own safety, that they've also been had the testing in this way. So yeah, we are very concerned. We do think that there should be more access. At the moment, it's not having the impact that we would want in our areas, because as you say, there's a huge demand, but we do think this has got to be part of returning to work after lockdown in those places where it hasn't been operating in a more safe manner.
Thanks, Di. And another good question that's been raised is, which I think is a really important one and something that people on this call will be thinking about, and that's, how do we support workers in their demands as local Labour Party members, as local Labour parties? How do we show our support? You know, if there was industrial action taken, we might we might donate, we might show solidarity on a picket line, we might have an event, or we might invite a speaker along, but obviously none of those things are quite the ticket at the moment. How do we support workers in their workplace as Labour Party members, as local Labour parties at the moment? Have you seen any good examples, or do you have any good suggestions for how Labour Party members could do that?
Well, I'll say first of all that the Shadow Labour team has been making links with all the unions to discuss the issues that workers are facing and what they can do as an opposition to make sure that the government is held to account, as well as we are meeting with the departments and officials in a way that we never have been recently as trade unionists. And I think Labour's playing a really important part in making sure that workers' issues are really at the forefront. But I think tomorrow, for International Workers' Memorial Day at 11 o'clock, we are asking for everybody to have 1 minute silence to remember all those people who have been killed or harmed through their working lives, and in particular, those who've been affected by COVID-19 coronavirus. So I think if we're thinking of something that everybody can do to show their solidarity and support, that's 11 o'clock tomorrow on International Workers' Memorial Day. They can stand in support. And I think also when we've had the fantastic shows of solidarity at 8 o'clock on a Thursday, everywhere, in all different ways that people have shown that it is NHS workers and key workers. So it's a very, very wide cross-section of workers that are part of that. And I think people do value that and have recognised that and do feel much more respected. I think also the way in which people react when parcels are delivered and other things, that can make a difference to how somebody feels. When you get on the bus, although you're not going to be as close to the driver if we're doing this properly, just to acknowledge that they're there and that you're trying to keep them safe. When you go into a supermarket, that there were days when people at the very beginning were trying to stockpile and they were abusing people that were working in the supermarkets because of empty shelves or things they couldn't get. Treat people properly. Those kind of things, I think, are basic, but that can be done in an organised way by Labour. Labour is also, with community organisations, linking up and supporting people who are isolated in the community. And I think linking between people who are in the community and people who are in work is something that Labour could play a really good part in doing with trade union movement as well.
Fantastic, that's great, Di. So obviously the day-to-day behaviour of each and every one of us, how we engage with key workers at the moment, whether that's in shops, whether that's the bus drivers, whether that's the posties, whether that's the refuse workers, whoever it is, you know, day-to-day behaviour around them is obviously incredibly important, and probably something that you know, perhaps goes underappreciated, I suppose, in the trade union and Labour Party movement. We're very used to kind of mass actions of solidarity and you know, showing solidarity on picket lines or passing motions or whatever it might be. But yeah, you're right. The day-to-day sort of way in which we're engaging with one another, and particularly those people at work which may be feeling sort of fearful or anxious, and we've seen the numbers of. I think USDAW had a survey out today that said almost, I think it was over half of retail workers had suffered abuse over this period, which is absolutely shocking statistic. So if we can all play our part in showing sort of within our behaviour, that would certainly mean something. And of course, as you mentioned, it's International Workers' Memorial Day tomorrow. We'll have a minute of silence at 11 a.m. to remember those that have passed away this year. I think we've got Christina back.
You have. Sorry about that. I've completely lost power here, and then
you lost power.
Well, I lost all my internet connections. Just take me ages to get back on again.
Oh dear. Well, it's great to have you back. So there's a particular question I've got around nursing home staff, and that's a question from someone that works in a nursing home, and the question is about whether they've been, if they've been put in a position where they feel PPE is inadequate, where they may be put at risk. What would your advice be for them?
Okay, so we've got very clear advice on our website, and we've sent out direct links to. We've got 100,000 emails for care workers who are members of our unions. We don't have them all, but we've got just over 100,000, and we sent them an email last week with very clear guidance on this. So there's Public Health England, and across there's 4-country public health guidance on what the PPE is for different settings. I have to say, Public Health England, I think, made it more complicated just the other week when they put out some other guidance, which we didn't think was particularly helpful, and we're still pursuing that directly with them. But our guidance is quite clear. So what we've said is go on, check what you're supposed to have for the circumstances. So depending on the job you're doing and the task that you're doing, what the PPE should be. If your employer says you're not getting it, then or you don't have it, then you have the right to protect yourself. So at the end of the day, the health and safety legislation is quite clear that you as an individual have the right not to go into an unsafe situation. And if that's the case, what we're saying is raise it with your employer. So we're trying to get people to keep a record of all of this. So raise it with your employer. Make sure there's a record where you can of the fact that you've raised this. If you're not getting the right answer and you're a member of a union, contact your union, get them to take it up. At the end of the day, if they decide not to go into work because they're not getting what's the recommended PPE, then Unison's position is quite clear, which is we will back them and give them legal advice for all of that.
Brilliant. That's very clear. Thank you, Christina. The other question which I put to Di, is a huge all members is testing. And the lack of availability of testing for frontline workers, particularly frontline health workers, care workers. I imagine that's extremely anxiety-inducing when some of your members may feel that they have COVID symptoms. They want to be there helping others on the front line. They're not quite sure whether they've got it or not. And obviously there's a lack of testing capacity. How much of a worry is that thing? How much of a demand is that for your members?
Yeah, can you hear me?
We've got you.
Yeah.
We've got you.
Right.
Okay, I'm getting a terrible feedback. I don't know if you're getting it, but
I'll try and go through it anyway. So it's something that gets raised with our members by members all the time. So it's again, there's an issue around being able to access the testing centres. So even though the government's announced new mobile testing centres, they're talking about 48 in the country now. 48 mobile testing centres, I think, would barely cover London, never mind anywhere else. So I'm not quite sure how. I mean, I suppose it's better than what they had before, but it doesn't really address the problem. So we're saying that no one should have to travel more than about 20 minutes, half an hour maximum, to get to a testing centre. Got to bear in mind that many of the, particularly home care workers who travel between clients, don't have their own transport. So they're reliant on public transport, or they have to walk. They certainly don't want to have to then take 2 hours to go and get tested. Many of them are only paid for the absolute visit times when they're actually in with clients. So again, we're pushing every single care home or care provider to say, if staff are to be tested, it should be done locally. They should be given time for it. It should be paid time to get tested. If possible, get it done within the care homes where they work. But again, for care home workers, for people who work in some domiciliary care who go out to other people's homes, that's not possible for them. So again, using perhaps supermarket car parks in a particular locality, or the local authority car park, so that people can go in and get tested in their local community is what's important. The big problem here is the government obviously hadn't been prepared for this. I mean, we've been talking about this for weeks and weeks and weeks now, and we're still just getting to the point where there's 20,000 tests or something being done, whereas they promised there would be 100,000 a day done by the end of this month. As far as we can see, they're nowhere near that. I haven't seen the latest thing tonight from the minister, so I don't know whether the figures have improved drastically over the past day. But I mean, we are where we are. The problem we've got at the moment is there isn't enough mobile testing. There isn't enough local testing for people. Testing. Sorry, just come screaming through. Testing only gives you a snapshot, of course, and the whole issue is about continually monitoring the situation and people feeling safe to be able to say, I might have tested okay last week, but actually this week, these are the things that I need to be looking for, or the people that I'm visiting have been okay this week, but we've had 2 declared cases of Covid-19, and therefore we want to be tested again, or we want that client group to be tested again. So those are the issues.
Fantastic, thank you. And the question that I asked Di was, is that better?
No, that's really
loud.
And that's better.
That's better, fantastic. A question that I asked Di as well, fantastic question that came in, is about what Labour Party members can do to show support and solidarity to key workers on the front line in terms of their demands. Usually in normal times, when there wasn't social distancing, there wasn't an outbreak, we would come together, on picket lines, we would donate, we would, hold rallies or whatever it might be. That's obviously not an option. Obviously, it's International Workers' Memorial Day tomorrow, and there will be a minute of silence to remember those workers that we've lost this year. Is there anything else that you can think of, or your members, or that you might find helpful, useful, in terms of supporting their demands and showing solidarity?
So obviously the clapping on a Thursday night is very welcome. I mean, certainly our members feel it does give them a huge boost, so they're very keen on that. The other thing I think is the minute silence tomorrow will be important to make that the point quite strongly. And my advice would be to wait to sort of join in with union campaigns as and when they come out. So there's a lot of work going on just now to try and raise money for welfare causes, because there'll be lots of people who've lost money who are not getting paid, or low paid workers on furlough losing 20% of their pay. So anything that can be done around that, so donating to these kind of to those kind of causes. But there will come a point where we're going to be doing a lot more political work around this, though. So working to try and, you know, it does kind of feel that at the moment we're in crisis, and therefore we're all trying to pull together to make it work, including the Labour Party, to get the country through it. But there will come a point when we have to hold this government to account. And I think that's when we'll be looking for support from Labour Party members, in particular things like contacting MPs, raising particular issues and points as we go forward, and trying to find our way through this at the end, and some of the long-term ambitions that I mentioned at the beginning around trying to get a better recognition of the work that these essential, the jobs that these essential workers do.
Fantastic. Thank you so much, Christina. Carl, I'm just going to bring you. I'm going to bring you back in quickly. Because I realise you've been. Sitting patiently while we've been talking.
Yeah. I mean,
is there any of those points that you want to pick up around PPE standards, shortage of PPE, testing frontline workers, and showing solidarity?
Yeah, I mean, clearly the testing hasn't even been provided for NHS frontline, so other key workers haven't been put within that as well. And you know, we welcome the move this week. However, believe that it's far too late in the day and should have been done a long time ago. On the solidarity front, I think that, you know, what we can do is a lot of trade unions, obviously now having to use electronic means, are putting out petitions around different things. And I think that a way that people can help and support is by making sure they sign them petitions, share them petitions, and give them maximum publicity. Some practical things for some of our members, particularly those that are delivering mail, is, you know, a lot of the places where they would go to wash their hands or use the toilet have closed down. So if you are in a position to be able to offer them sort of just the small facilities, you know, the small facilities, then that would help. On the PPE, you would have probably seen that in order to get the PPE, a lot of our members, particularly in Raw Mail, actually did their own protests because it wasn't safe to do so. And, you know, we backed that and were around it because there are legal obligations on the employer, and that has helped get the PPE. It's amazing how quickly the PPE tends to arrive after there's been a protest in a particular area. And, you know, I want to thank other Labour Party members and the public for the support that they are giving our members. And, you know, whilst at times it can get frustrating, but key workers on the front line, and we would just ask that everybody, you know, these people are working through testing times, and that, you know, please just, you know, say hello, thank them for what they're doing, and give them the respect for trying to keep the country connected.
Wonderful. Thank you so much. Thank you, Mick, I'm going to bring you in to round up the conversation and close it off.
Well, thank you. First, can I thank you for making this happen tonight? Can I apologise to the people out there for some of the technical difficulties? We will do this again. We look forward to communicating with you all. Can I thank all four of the speakers this evening? It does prove the power of Labour. It does prove the power of unions together. I would encourage everybody to join a trade union, but also I'd implore everybody, if you know somebody's in trouble, let us know, let us help. And everybody has said it's about what we do after this. It's great coming together. It's great showing the power and the necessity of key workers everywhere. But let's let nobody forget when this is over. And let's use tomorrow as a stepping stone on International Workers' Memorial Day to celebrate all those people who unfortunately have died from coronavirus, but all of those people on the front line that have looked after everybody else as we move through this. And there will be a time when we do hold this government to account. There will be a time when we look at how the poorest in society have been most impacted by the fact of austerity and have borne the brunt of the suffering or the deaths that have gone on. But for the moment, as a community, as a country we work together, and workers working together can change the world. Thank you all for this evening.
Thank you all.